and I'm an independent broker and member of the Hogue Senior Services team. I'm here to tell you that yes, Medicare can be confusing, but it doesn't have to be. The Turk Insurance offers all the options for Medicare beneficiaries, Medicare Advantage, Medicare Supplement, prescription drug plans, and can offer advice on how to leave an employer group health plan, as well as other things related to Medicare, many other things really. Collectively, our team has over 70 years of experience in the healthcare industry to help you make an informed decision. We are here in the midst of the annual election period to answer any questions you may have regarding Medicare, at least the general ones. If you have any questions after the presentation, please give me a call at 949-929-0553. Thank you.
Great.
Diana, do we have any questions?
Let me take a look. Well, welcome everyone. As you log in, there is a chat box on the right-hand side. Feel free to jot your questions in there and we will certainly address it, okay? But in the meantime, we do have a couple questions to kind of get the ball rolling. So the first one, Medicare has many enrollment periods, which we're in the midst of one, as Dan mentioned. Can you talk about the annual enrollment period?
Sure. The annual enrollment period is also called the annual election period. We refer to it shorthand as the AEP. AEP is an annual period during which you can either elect to go into Medicare, it's one of the entry points, for two of the parts of Medicare, Medicare Advantage and prescription drug plans. It is also the time frame within which you can change what you have currently. Now, this time frame is for people who don't already have something in place. So if you have an employer plan, you do not need to do anything during this period except renew your enrollment in your employer's plan. You're getting a lot of mail because it is really the only way that people can contact you during the annual election period. It's really the only way they can contact you unless you reach out to them. And once you open that door, then they're free to call you as long as you give them permission to call. So that's why you're probably getting a lot of mail.
Great. So our viewers, how do they know which Medicare plan is right for them?
Well, it depends on a number of factors. There are a couple of different ways that you can go with Medicare, really only two. One is an HMO style, and the other one is a PPO style. The HMO styles are known as Medicare Advantage plans, and the PPO are called Supplement. Depending on how much flexibility you want with your Medicare is going to make a difference to you as to which path you take. What else? Prescription drugs may play a factor in which type of plan you pick, as well as your network of doctors.
We do have a question that just came in. So if this individual chose a Medicare Advantage plan now, can they later switch to the Medigap or Medicare supplements?
You can. There are some limitations. There are two things that are involved with going to a Medicare supplement plan from a Medicare Advantage plan. The first one is that there is a cost associated with the supplement plans, the PPO style. The Advantage plans in Orange County are very low cost. And so that can be a little bit of a hurdle. The second thing that we are concerned with going from a Medicare Advantage to a supplement plan is that you will have to answer a series of medical questions if you're outside of a certain time frame. That time frame is within 6 months of obtaining your Part B. There is an exception going from Medicare Advantage to supplement. If you test drive an Advantage plan for less than a year, you can get into a supplement plan without the underwriting. Underwriting is a tricky proposition because if an insurance company finds that they don't want to offer you coverage, they can actually decline to offer you coverage. Let's say you have a medical condition and they don't want to get socked with a bill for $20,000 within the first 2 months of collecting a premium of say, a couple of $100s. So they get $400 in and then they get a bill for $20,000. That doesn't pencil for an insurance company. And so what they'll do is they'll say, we see you have this medical condition and we will decline to offer you coverage. Go away, get well, come back in a couple of years and we'll look at it again. So that is the worst case scenario. There are actually 4 other ones. The first one would be, welcome to the club. Dan quoted you a price. You're good to go. and you can go on your merry way. The second thing would be, oh, we saw you answered number 6 in a kind of a funny way of these questions. We are going to make you wait for a period of time, and if any claim comes up related to that condition, then we're not going to cover that claim. So that can be a trick. The third thing that they can do is they can say, we're going to just charge you a higher premium because we see you have this little thing going on. And the fourth thing would be, we're going to do 2 and 3. We're going to make you wait, and we're going to make you pay a little bit more. And of course, the fifth thing was, we decline to offer you coverage. So those are really the 5 things that can happen when you go through underwriting. And so if we can, we try to avoid it.
Excellent. Let's touch base again on the Medicare Advantage plan. So there are over 50 plans in Orange County. How does someone know which plan is right for them?
It's going to depend on a few factors. As we mentioned before, your network is important. When you sign up with an Advantage plan, the insurance company, whichever one you pick, will have a contract with specific medical groups. And so as long as your doctor and your specialists are in the same medical group, an Advantage plan can work really well for you. You would use your primary care doctor as a referral source, so they're the gatekeeper really, and they refer you to other specialists within their medical group. So that's super important because your relationship with your primary care physician is going to drive how well you receive your services. The second thing is prescription drug coverage. Every Medicare Advantage plan has a formulary, which is the list of medications that they're going to provide to you. Inside of that formulary, there are tiers. The least expensive of the medications is on tier 1, and you can move your way up to tier 5. Tier 5 being rheumatoid arthritis, multiple sclerosis, HIV cocktails, things like that. So tier 1 might cost you no cost at all, whereas the tier 5 would be 33% of the cost of the medication. So you have this tiering structure within each Medicare Advantage plan, and sometimes the insurance companies will have, let's say ABC company has a tier 2 medication, but the same medication in DEF is a tier 4. And so you want to make sure that your medications are the least expensive for you wherever you go. And there's an optimum mix of medications.
Excellent. Is there a penalty if they do not take Medicare? So I guess that depends.
It does. Yeah. So if you have an employer group health plan, you don't need to sign up for Medicare. If you don't, that's when you run into trouble. There is a time frame within which you need to sign up for Medicare, A, B, and Part D without penalty. I guess I should take a step back. For Part A, you don't need to sign up for Part A. You've paid into a trust fund through your working career, and you don't need to pay any more. If you don't sign up for Part A, there's no penalty. Part B, however, there is a penalty associated with that if you don't sign up within 8 months of leaving your employer plan. So if you have an employer plan in place, you do not need to sign up for any of the parts of Medicare. For Part D, it is within 63 days of leaving employer coverage, and for Part B, it's within 8 months of leaving employer coverage. So leaving employer coverage creates this special election period during which you can sign up for Medicare B and D without penalty. Did I cover that adequately? Okay.
So follow-up question. So how can you get assistance with targeted therapy medications if you are on Medicare? So I think this is to address medications that fall under Part B and then medications that may fall under Part D as in dog.
Okay. So should we take a step back and look at A, B, C, D?
Sure.
Okay. There are 4 parts to Medicare and 4 parts only. A is acute care. It's called hospital insurance by Medicare, and it really covers in-facility services. So if you go to the hospital, obviously that would be covered. It's called hospital insurance. Skilled nursing facility, home health care if a doctor orders it, hospice if a doctor orders it, and after the first 3 pints of blood. So really the catastrophic stuff. It's a safety net that the government established in 1965. So that's Part A. Part B is everything else. Doctor office visits, specialists, durable medical equipment, chemotherapy that you'd get in a doctor's office, infusions, So there are certain medications that are covered under Part B of Medicare as long as you get them in a doctor's office or in a facility. The kind of medications that you get outside of a doctor's office are called Part D. Part D is prescription drug coverage. So that's really A, B, and D. And then Part C are the Medicare Advantage plans that we were talking about moments ago. Generally, they take the form of an HMO. Those Part C plans encompass everything that you would get under A and B of Medicare. They often include prescription drug coverage, and they usually have what are called lifestyle benefits, which are gym memberships, vision, sometimes dental, hearing aid coverage. What else, Diana, is included in their lifestyle benefits?
Transportation, over-the-counter, just to name a few.
Right, right. So the Advantage plans are very attractive because they have a low premium and they encompass all of these things together. It's like a prefix meal, whereas the original Medicare doesn't include prescription drug coverage, and it has some gaps in it. And so we look for ways to fill those gaps with something called a supplement plan. So this is more like an a la carte meal. You've got A and B of Medicare, which gives you tremendous flexibility. You have a supplement plan that fills in the gaps of Medicare, and we can talk about that in a second if we have a moment. And then you need prescription drug coverage because neither original Medicare nor the supplement plans include prescription drug coverage. So you've got A and B, you're paying extra for a supplement. There is a premium for that, as well as a premium for Part B, and then you have to pay a premium for Part D. So when you bring those all together, that's a complete healthcare package, which is why Medicare Advantage plans can be very attractive for some folks as well.
Great. So if you have specific list of medications or therapy medications that you are taking, you're welcome to contact Dan, and someone on his team can verify the coverage for you and let you know if it falls under Part D, your prescription drug, which you would pick up at the pharmacy, or it would be covered under your Part B in your medical, okay? Moving on, let's see. How do we notify Medicare of a change to Medicare Advantage, or does the plan administrator take care of notifying of the change?
If you're changing from a Medicare Advantage plan to another one or to a prescription drug plan, you don't need to do anything. Medicare will notify the carrier, the insurance company, of that change. So there's nothing to do there. Supplements are a little bit different because they're a contract. You have to actually notify the carrier that you want to change that contract. So we looked at going from a Medicare Advantage plan to a supplement. And if we go the other direction, we go from a supplement to Medicare Advantage, that's fine to do, but again, you need to notify the insurance company that you're changing from the supplement. You're canceling your contract. So you have to, it's best for you to do this, is to write to them. Then you have a written proof that you wanted to do it rather than a phone call that, I don't know, we never got that phone call. So if you're going to change from a supplement, you need to write to the carrier and make that change. I guess that's all I have to say about that.
Okay. So let's touch on Medicare supplements. How do you know which supplement is the right plan, since there's so many that are available to choose from?
Right. There are, unfortunately, supplement plans that are lettered. If it helps to distinguish, there are parts to Medicare, A, B, C, D, and there are plans to supplements. So the supplement plans are lettered A through N, and the most popular two these days are F and G. The F plan covers every gap really that Medicare has. The G plan covers almost every other one. And so I guess we should take a look at what the various costs are associated with original Medicare, that's A and B. For Part A, if you go to the hospital, you're going to pay, in 2021 anyway, you're going to pay $1,484 each and every time you go to the hospital. So if you go 3 times in 1 year, you're close to $4,500 out of pocket. If you go to a skilled nursing facility, it's something like $178.50 a day after day 20. Under Part B of Medicare, the other part of original Medicare, you're going to have a small deductible, just one time per year, of $203. After you pay that $203, then you're going to be on the hook for 20% of whatever Medicare allows a provider to charge under Part B. So let's take an example. You go to, let's say, a specialist, and the specialist wants to charge $200 for the office visit. The specialist sends the bill to Medicare, and Medicare sends the bill back and says, we only allow you to charge $100 for this visit. Here's $80 from us, our 80%, and you can get the other 20% from Dan, the other $20. So that works well after you've paid your $203 first money out of pocket for the year. There are some specialists who do not take Medicare, but they'll bill Medicare for you. And they'll say to you, I don't take Medicare. I'll bill them because I know what the codes are. And just because of this favor for you, I'm going to charge you an administrative fee of 15%. You will be charged the 20% plus the 15%, I'm sorry. So let's say in the case of the specialist, if they wanted to charge you $200, they would send the bill to Medicare. Medicare would send it back and say, we only allow you to charge $100, here's $80, and you can get the other 20% plus the other 15% from Dan. So I would be on the hook for $35. Now that's not a lot of money when we're talking about a $200 bill, but really the two types of doctors that charge this administrative fee called a Part B excess charge are emergency room doctors and anesthesiologists. So I don't know what 15% of a lot is, but it's probably a lot. This is what we have to be careful of, is these gaps in Medicare. The $1,484, the amount after $179 for a skilled nursing facility, the $203 deductible, that's not a lot of money every year, the 20% coinsurance, and then the possible Part B excess charge, really only for those two groups of doctors. The supplement plans will fill in those gaps. So now we come back full circle. The F plan will fill in all of those gaps. The G plan will fill in everything except the $203. So the Part B deductible is the only thing that the G plan doesn't cover. After that, it fills in all the gaps. You can have more risk if you want with the different lettered plans, but most people opt for an F or a G because they don't want to have to worry about how much is mine, how much does the doctor pay, or how much does the doctor have to write off. You don't have to worry about any of that with Medicare. There's no balance billing. I think I got that.
Great. To follow up on that question, if someone gets a Medicare supplement plan, typically they pick up a prescription drug plan. Some of our viewers here may not be taking any medications, so why do they need to pick up or purchase a drug plan if they don't take any medications?
Well, that's a really good question. I've had that a couple of times in the year that if you don't sign up for a prescription drug plan, Part D of Medicare, you will probably be penalized for not having been at the table paying money in. The way that Medicare views insurance is that you put money into a pool, and the people that really need the help, they have that money accessible so that they can treat their conditions. It's just like car insurance, really. So if you're not at the table, they're going to penalize you 1% for every month that you don't have a prescription drug plan. That's number one. Number two is if you don't have a prescription drug plan and something happens and you need an expensive medication, you're not going to have any insurance for it. I know myself, as time has passed, when I was younger, I was invincible, and it's just not that way anymore. I get up in the morning and I've got creaks and groans, and so you never know what's going to happen. That's insurance too. So if you're going to have an expensive medication come along and you don't have coverage for it, you have to wait until the next election period, the annual election period, to sign up for a prescription drug plan, and it won't start until January 1st. If you have to pay for an expensive medication from April until January 1st, that will hurt you. And then to get a penalty assessed on top of that will just cause more grief. So it's better for you to just have a prescription drug plan, and there's some very low cost ones too. If you do not take any prescription medications, there are plans that are even below $10 a month. So it just doesn't make sense not to have the insurance.
Great. So this is a follow-up question regarding Medicare Advantage. If they select a Medicare Advantage plan that has drug coverage, do they need to notify the drug plan that we currently subscribe to a new plan?
So if I understand the question correctly, if you sign up for an Advantage plan and you had a prescription drug plan, you don't need to do anything. It will automatically terminate the old prescription drug plan as of December 31st. The new Advantage plan with prescription drug coverage will start on January 1st. Again, though, if you're leaving a prescription drug plan, a standalone, a Part D plan, then that implies that you have a supplement, and you'll need to notify the supplement company for sure that you're leaving their coverage.
Great. So let's touch base a little bit about if you're new to Medicare, what do you need, what steps do you need to take to enroll for Medicare?
If you're new to Medicare,
So you just turning 65 soon.
okay, thank you. There are two ways that you can go. If you're taking Social Security, Medicare will assume that you're not working, and they will send you, or they should send you, a Medicare card in the 3 to 4 months before your birth month. If you are not taking Social Security, you have to apply for Medicare A and B. That's your foundation, A and BR. You can only apply for A and B through the Social Security Administration, and so what you would need to do is you can sign up online for A and B of Medicare.
This will be called the initial enrollment period, and you have a time frame to do so.
Right, thank you.
You're welcome.
The initial enrollment period, or the initial election period, called IEP, that is a window of opportunity that lasts 7 months. The 3 months before your birth month, the month of your birth, and the 3 months after. So let's say you're an April 19th baby. Your Medicare insurance always starts on the first of a month, whatever the month is. If you sign up in January, February, or March, those are the 3 months before your birth month, you'll start on April 1st. If you sign up in April, it'll start on May 1st. May 1st, it'll start June 1st. June and July, the last 2 months, Medicare will delay when your Medicare starts, and so you have to be careful with this. The best advice to you is to sign up in the 3 months before your birth month if you don't have anything else in place, and then your Medicare insurance will start on, let's say, April 1st for this person. You can sign up as early as January 1st, even though your birthday is April 19th. Okay, so it's always going to be the first of the month.
Great. So that's when you're new to Medicare. Let's say one of our viewers is past the age of 65 and they're leaving their employer group. Do they have a special enrollment period for that?
Yes, they do, right. There are a number of different entry points into the Medicare system, and we talked about the AEP, which is right now, IEP, which is when you're first turning 65, and then there are SEPs, special election periods. The special election period that we're talking about right now is leaving employer group health plan, EGHP, leaving group coverage. As long as 3 conditions prevail, you have a safe harbor within which you can stay until you decide to leave employer coverage. And once you leave that employment, then you're out into the open sea and you need to apply for Medicare within, as we mentioned, 8 months for Part B and 63 days for Part D. Leaving employer group plan will require 1 or 2 forms. It just depends, and your broker will know what to do about that. But one of the forms is applying for Part B. Some folks will apply for Part A when they're first eligible, but they didn't get Part B because that's the one that carries a premium. So if you are in that situation, you'll need to sign up for Part B, and that's one form. And the other one is the waiver, and it says, this is why I didn't sign up for Part B when I turned 65. I had employer coverage. Here's my employer's information and the insurance information, and so don't penalize me. I'm ready to start Part B. So that's leaving employer coverage.
And can you clarify what would be considered as credible insurance coverage with an employer group?
Yes. There are 3 conditions that need to prevail for you to have employer coverage and be in that safe harbor. The first is that you need to be actively employed or married to an individual who's actively employed and has that group coverage. You have to be on the group coverage. And the last thing is that the employer has to have more than 20 lives on the insurance policy. So if you're with a big company, you don't need to sign up for Medicare. If you're with a smaller one or self-employed, you need to sign up for Medicare when you turn 65.
Great. So we have a question here. If you're on a Medicare Advantage plan, can you travel out of the area and use providers out of your regular network, but still be in the provider's nationwide network?
Yes. Yes. Medicare Advantages have a provision to give you urgent care and emergent care wherever you are. I think most of them are cover you internationally as well, although it's a reimbursement system. You pay the bill on your frequent flyer card, and then you come back and submit itemized receipts that are in English, and they'll reimburse you less the cost of whatever whatever cost that they would assess you for in the United States. So the difference between urgent care and emergent care sometimes arises. The first is emergent care is you think you're going to lose your life. You've been in an auto accident, you're having chest pain, things like that. You'll go to the emergency room because you want to be safe. Urgent care is I've cut my finger, I can't get it to stop bleeding because I'm on a blood thinner. I'm not going to die from it, but I need to get it taken care of quickly. Ear infections, things like that. When you're out of area, the Advantage plans cover urgent and emergent care no matter where you are. What they don't want you to do is get routine care out of a specific geographic area, and that is the county in which you reside.
Great. Another question, are there Medicare Advantage PPO plans?
In Orange County, there are 2 Medicare Advantage PPO plans, and you can access them if you'd like to. They carry a premium, and they include prescription drug coverage.
Great. Let me see. I think that's it with the chat box. So let's talk about why should an individual work with an independent broker?
Well, at Paterka Insurance, our focus is Medicare, and your journey with Medicare through time. We're not an 800 number. We are actually live people, and we actually enjoy meeting with folks. Actually, this is 2020 BC, right? So, but we still enjoy meeting and look forward to doing so as well. But there's always a live person on the end of the line. We don't charge any fees, and as brokers, we can provide you with a variety of choices. And here we make a distinction between agents and brokers. An agent is someone who works for a company, and a broker is somebody who represents different insurance companies. And so brokers are able to offer you sort of a spectrum of choices depending on what your needs are. We are local, and we're familiar with the area networks, including Hoag Hospital and affiliates.
What does the POS stand for in the HMO POS? So if you can get clarification on that type of plan.
Sure. A POS is a point of service plan, and what it indicates is that even though you have an HMO network with a gatekeeper and a medical group, sometimes, or for some specific services, you can go outside of that network and be charged more to see specialists, maybe get a second opinion, things of that nature. With a POS, you have to be careful though, because your network, first of all, your medical group has to participate in the POS to allow you to go outside the HMO to a different service, but also you have to know which specific services are covered under the POS, because if you go to someone and you're not supposed to, you make it charge full cost.
Great. Is there no fee to work with a broker, and why wouldn't I work with a broker?
I don't know why you wouldn't work with a broker, but I'm one. So There is no fee associated. We are paid by the insurance companies that we represent. So I think, I mean, this is subjective, but it's nice to work with somebody who has maybe 6 insurance companies that they work with. So you get still a broad spectrum, but anything over that can be a little bit much to keep track of. Every year we are required to recertify with the companies to make sure that we know what all of their products represent, and that we're giving current information to the beneficiaries. By the way, you're considered to be a beneficiary under Medicare's rules. You've paid into a system through your working career, and now you're going to receive benefits as a result of that. So you are considered to be a beneficiary. You may see a line on a form if you meet with an agent, either on the phone or personally. They're going to ask you to sign a form, and the form is called a scope of appointment. It's a permission slip for us to talk to you about Medicare, certain parts of it. We talked about A, B, C, D, Part C plans, Part D plans. Sometimes there's a standalone dental that you can get. So you check a box and you sign on this line that says beneficiary or authorized representative. You are the beneficiary, so you can sign that. It's not for to put your spouse's name on. An authorized representative is someone to whom you've given power of attorney for healthcare decisions. So most often you are not the authorized representative.
It doesn't look like we have any other questions in the chat box. So
Okay.
I'll give it another minute. Oh, just kidding. Does the out-of-pocket limit in Medicare Advantage apply to the drug copay costs, if any? So there's the medical.
Right. So
That's
there's
an
a
out-of-pocket.
right. So no is the flat answer. Medicare prescription drug plans have 3 different levels of coverage. The first is known as the initial coverage limit, then comes the coverage gap, and the last thing is called catastrophic coverage. For 2021, the initial coverage limit is $4,130. Then you slip into the coverage gap, or the donut hole, it used to be called. And after $6,550 of medication costs, you are in catastrophic coverage. So those 3 different levels. The initial coverage limit is $4,130. You'll pay a deductible, and after you pay that deductible, you can pay up to 25% of the cost of the medication. When you've reached $4,130, you now are in the coverage gap, and the coverage gap actually has you pay more. It has you pay for sure 25% of the branded or the generic cost. When you get to catastrophic coverage, $6,550, now your costs drop because you are in catastrophic need. You'll pay at most 5% of the cost for the medication. How does it work? Let's say you take one medication only, and it's $413. You have a prescription drug plan through Medicare, one of the Medicare prescription drug plans. In standalone, there are 32 different ones in the state of California. So you take one medication, it's $413. The insurance company says, hey, you're with us, we're only going to charge you $5 a month, we're going to pay the other $408. By the end of month 10, October, you'll have paid $50. The insurance company will have paid $4,080. Between the two of you, you and the insurance company, you'll have paid $4,130. You are now in the coverage gap. At that point, November, when you next fill your prescription, you will pay 25% of the cost of that $413, which is $104 roughly. And you'll do that again in December because you won't get through the coverage gap to catastrophic coverage by December. So once you get to catastrophic coverage, if you ever do, you're going to pay 5% of the cost of that medication, which drops down to what, $80. I think that's right.
I'm not a math major.
I'm not either. So it's $20. It's 25 times 413. So that's how Medicare prescription drug coverage works. 3 different levels. Catastrophic coverage is possible, but really only if you take an expensive medication. Now, my example was $413, but most medications do not cost that much. They're generally, the generics are $20 and less. So if you take a number of generics, you're probably not going to hit the donut hole. If you take brandeds, that's where you can run into the donut hole. Breathing treatments like QVAR and Pulmicort and things like that, that could push you into the donut hole. So you just need to work with your broker to determine, okay, am I going to hit the coverage gap? What's the best way to position this so we have a good prescription drug plan as well as adequate coverage, and it's not going to cost me too much.
So you just covered the Part D prescription drug coverage model. As for the annual maximum out-of-pockets for the Medicare Advantage plan, what type of items count towards that limit?
Anything that would be covered under A and B of Medicare, that's generally what counts towards that maximum out-of-pocket. Medicare's requirements are that an insurance company can charge you no more than $6,700 this year as your maximum out-of-pocket, but a lot of the Advantage plans in this area are far, far less. $1,000 and less is the maximum out-of-pocket that you will pay for your health care. We talked about the Advantage plans having lifestyle benefits, chiropractic, acupuncture, OTC. All of those things, or maybe I should say none of those things really count towards your maximum out-of-pocket. So if you need to have chemotherapy, which is covered under Part B, like we talked about before, your maximum would be whatever the maximum is under that Advantage plan.
So your hospital and your medical services are covered under the
maximum out-of-pocket.
Okay. If we choose a Medicare Advantage today, can we later return to a regular Medicare during open enrollment? So my friend Michael Jones here is doing his homework. So the next enrollment window after AEP.
Right. There's a new enrollment period that, well, it's not new, it's refashioned. It's called the open enrollment period, another entry point for Medicare. But the open enrollment period really relates only to people who have Medicare Advantage. So if you have an Advantage plan, it's called the MAOEP. If you already have a Medicare Advantage plan, you can go back to original Medicare if you'd like, and a separate prescription drug plan during the first quarter of the new year. It's a one-time opportunity to change. You can go from an Advantage plan to an Advantage plan, or you can go from an Advantage plan to original Medicare and a prescription drug plan. But you cannot go from original Medicare to to an Advantage plan, nor from a supplement to an Advantage plan. It's only for somebody who has a Medicare Advantage plan in place already. Is that clear?
And did you say what the time frame was for that?
Yes, it's the first quarter
to
March 31st.
Got it.
January 1st to March 31st.
Excellent. Okay, so if this individual is qualified for employer plan, is in a qualified employer plan, and turns 65, is there any reason not to enroll for Part A? There's no cost for them, and they don't want to worry about it enrolling later on.
That's pretty good summary. Yeah, there is no cost associated with Part A of Medicare. It's extra insurance. There's no reason not to get it.
Okay.
Yeah. Now, by the way, when you leave your employer coverage, you will have to fill out those two pieces of paper, the one saying, I want to apply for Part B, and the other one saying, here's why I didn't when I turned 65.
Okay, let's see. This individual has both Medicare and Medi-Cal. Is there any advantage to sign up for a Medicare Advantage plan or a supplemental program? You want me to answer that?
Yeah, why don't you? Diana knows Medicare and Medi-Cal well.
With Medicare and Medi-Cal, you have very specific providers that you can access. So I'll use Hoag as an example. It would be advantageous for you to sign up for a Medicare Advantage plan because that will give you access to Hoag Hospital. If you were just on Medicare and Medi-Cal, unfortunately, I don't believe they take Medi-Cal, so it would be advantageous for you to sign up for a Medicare Advantage plan. But connect with Dan's team and they can assess your situation and advise what would be the best option for you. Let's see, my next question is, can you go directly with the pharmaceutical company for the copay assistance program while on Medicare? I think Dan wants me to answer that question too.
I do, because it depends.
It depends. It does depend. So if you hop onto a pharmaceutical company and you're taking a high-end medication, like a brand name that's extremely expensive, you may see they offer a coupon program, right? But there are restrictions to that. You have to be on an employer or commercial plan or an individual plan to qualify for that coupon. But if you read the disclaimer, if you're on a Medicare plan or are covered with Medicare, you are not qualified for that coupon. They may offer other pharmaceutical assistance program. However, you do have to qualify for that. Once again, as I mentioned, contact Dan's team and he'll have someone that specializes in that, and they can research for you and let you know what your options are, okay?
And just as an aside, we did have someone we were talking to recently taking a very expensive medication on an employer plan, wanted to come off because the employer plan was expensive. It had a high deductible. And the medication under Medicare prescription drug plan was going to be $4,380 per month. Under the employer plan, it was far less expensive. So if you're thinking about leaving employer plan, that is a consideration for you. Employer plans generally provide better coverage in that respect, number one. And number two is they don't have the coverage gap. They don't have catastrophic coverage. They will cover your medications. And so that will be a serious consideration if you're thinking about leaving employer coverage.
I also want to point out, in addition to going directly to the pharmaceutical company to see if they have an assistance program, Medicare does have a pharmaceutical assistance program as well, where they work with nonprofit companies, foundations, that if they have funding, may help cover some of your medications for, as I mentioned, the expensive ones. However, it is funded, so if they have the fund available, then the program's open. Once again, you do have to qualify to receive the funding. Okay. Let's see. So I may move to Arizona. Are there Medicare Advantage plans in all areas?
No, there are not Medicare Advantage plans in all areas. If you know the specific county to which you're moving, we can help determine if there is one available in that area. But most likely, if you're moving to a place where there aren't a lot of Advantage plans, it might be beneficial to have a supplement plan in place because that gives you the flexibility to see all Medicare doctors. And you wouldn't have to worry about a network or a medical group that you need to, or with which you would need to affiliate under a Medicare Advantage plan.
I think it's you're looking for access, right? Depending on where you move, we're in Orange County, so there are a lot of doctor options. So definitely Medicare Advantage is a popular option out here in Orange County. But as Dan mentioned, if there are not that many providers, maybe in Arizona, in the specific city you live in, they may not have Advantage plans. So as he mentioned, supplement might be another option. Okay. Doesn't look like we have any other questions. Dan, would you like to share your contact information again? Since later on, if someone is viewing at a later time, you're not going to see the chat box with all the information. So.
Sure. My name is Dan Paterka. We have an insurance company here or an agency here in Newport Beach. The number is 949-929-0553. That's my cell phone, and I have it with me most of the time. I have it with me now. So if you have any questions, again, thank you for attending today, and we look forward to helping you with your Medicare decisions.
Thank you, everyone.